Hello, sir. This is Dr.
Hello.
Annie.
Oh, good morning. Oh, okay.
Okay, I am Dr. Annie Grace.
Right.
Maybe you need to see my face. I am Dr. Annie
Yeah.
Grace. Thank you for accepting to do this program for our nurses, especially on this International
Mm,
Nurses Day.
mm.
On behalf of the Nursing Council, I thank you for your kindness and the gesture for doing this program. I think you can start your program over to Mr. Rangarao, sir.
Yeah. I welcome one and all the nurses. It is not my acceptance. It is our duty. Today the world looks back. Today the world looks back on the services of three people or four people in the whole world. The first gate, the first people who fight with any viral infection or in the medical field. I say nursing department is like the infantry. The people those who fight with the enemy first. And they don't even know. They have to get down to the war zone. They have to fight. Then comes the doctors and the other departments, right? So three departments, what we call majorly doctors, nurses, your police, and your corporation people. They're doing their best for us all to survive. And it is our duty to do something back to your team. So I thought, okay, uh, on behalf of Tamil Nadu Nurses and Midwives Council, I'm really happy to do a session for you all. And I hope any more surveys on my side is needed, I'm definitely there to come. My name is Rangarao. I'm into Chinese martial arts known as Tai Chi and Qigong and Shaolin Kung Fu. I dropped out my engineering in my way back, 35 years back. I dropped my engineering out and I came into this martial arts. And I learned martial arts on the medicinal side. So I'm a trained acupuncturist, I'm a trained massage therapist, and I'm a trained healer. And though we are known, we call us healers and daughter maybe, I really feel my heart for more than 19 million nurses across the world. Today, I think it's 19 million nurses, those are working day and night. They're doing their life's best to make people to come back to normal life, right? So, do nurses burn out? The subject what I wanted to take depth is do nurses burn out? You all agree with that? Can I get a response? Do you agree that nurses do burn out?
Definitely, nurses do burn out because it's a day-to-day affair. We are like a roller coaster.
Yes,
In a roller coaster, morning we see a happy moment, evening
yes.
we see a sad moment. It is there, definitely.
And a situation like today, the burning out is more impact. And what happens is that basically nurses, they have compassion and love. They only give. Their work is to give, 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 give. And what's the job of the patient to take, 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 take? And but we always say, give us gain. But definitely, when the burnout starts, it impacts stress, and that stress can cause much more problem to your health. And as long as you're healthy, we can feel the other patients and everybody is healthy. Otherwise, it's very difficult. And the emotional conditions, what we call, make most of the emotional condition what nurses may be going through is fatigue and tiredness. When fatigue and tiredness hit, your health goes into a hazard, and you go into a lot of health issues, right? So I thank the great lady Florence Nightingale, Margdarshi of nursing system, the lady who have brought nursing as a department, where people have learned how to stay healthy, how to take care of the patients, because see, every part has its own way, a big role to play. And there may be chances when doctors may go on strike, but you don't find nurses going on strike. Very rare. I don't think I've not seen in my lifetime. In my lifetime, I might have seen junior doctors going on strike for a number of times, but very rarely we see. Very rarely we see nurses going on strike, right? Because you're taken a passion. It's a passion. Most of the nurse's job is with passion. And if there's no passion, definitely you cannot survive in your job. And you people are trained to live with passion, compassion, taking care of others, right? And as a common man, we have a second term for nurses. I don't know how many of you, number nurses, we also say in nurses what is called sisters, right? We also call nurses as sisters. And why we call sisters? After a mother, sister is the next person in life who can give the best compassion, best touch, the best love. Not even the wife. At old age, a man who has a sister, he looks for his sister. So she becomes his support, apart from the wife. So today's topic will be taking little directly to the subject because my session will be more on practical oriented because I want you to learn something to enhance your immune system, right? We all know COVID-19 affects the immune system, or people, those who are not having proper immune, if there is an immune deficiency, you're prone to get involved into COVID-19 issues. I don't know how many of us, I don't have the exact counting, but a lot of nurses and doctors have been affected by COVID-19. We have seen deaths also. And this interest came to me after seeing an article in Google saying that the male nurses and the female nurses treated patients at the time when it was going through the COVID phase in China. To share these articles with your team later.
Excuse me, sir, for a second. Excuse me. 1 second. My dear nurses, please all of you mute your mic, please.
Unmute பண்றேன் மேடம், ரைட் கிளிக் பண்ணி unmute பண்றேன்.
And yeah, can I carry on, madam? Can I carry on? So
yes, sir. Yes, carry on, sir.
Yeah, when COVID-19 was started and people getting into a lot of trouble in China, first male nurse who was a practitioner of Tai Chi, he took the initiation of practicing doctors, nurses, and the patient to practice Tai Chi, come back to normal life faster, because we always say movement is life, and there's no movement, there's no life. So when we come back to the subject, what we call as a nurse, do nurses burn out? Yes, so they do burn out. And in a situation like this, when you don't have time back to your house, we have seen so many scenes where nurse stands and you can't even see her baby. I had to go away from the hospital. And I don't know what is the hospital timings now. You people once enter, we don't know when you're going back home, right? Right? People, those who are working in the COVID system, once they enter, they don't know when they'll go back. Maybe 24 hours, maybe 16 hours, maybe 3 days or 4 days. So, first, let me see something what to be commonly. How many of you feel that most of you go through back pain? Anyone who feels very back pain when there's a lot of stress, there's a pain in the back, or shoulder pain, or neck pain? Right. I'm going to teach you something what we call as single finger Zen. It's an exercise to create energy. For example, what we do, we use sanitizers to the hand, right? We use sanitizers to the hand to keep ourselves safe. And this exercise will give such a power to your hand that your touch, when you know something is wrong, your hand will move back. Even a person who may not show positive to COVID-19, but if he carries the virus, when you touch the person, before you touch the person, you can feel a tingling sensation in your hand. And it's very important for nurses and doctors, because you people there are chances for you to touch the client, you have to ship them, you have to move them, and it's very important if you don't take care of your hands, not by only soaping, washing with the soap water, but there is an energy washing of your hands which can cleanse and which can take your minds together. If you all can see me, rub your palms, and how are you going to help yourself? I'll tell you one thing. Nobody is going to help us, right? Nobody is going to help us because everyone is cool. All that's one way because you see the good, you see the ugly, and you see the worst. And you're used to see it. And you know what will happen if you tell the truth. You will have issues, you will have problems. But with that truth, with that pain, you all live, you all work, right? Just hold your palms like this. With the thumb, with the index finger. And all the fingers in the center of your thumb. Your palms, put your hands like this. Breathe in slow. Breathe out slow. Breathe in. Breathe out. 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 Just keep the hands at 1 feet distance and just move, press slowly, push and pull. Can you feel something in between your hands? Can anybody respond? Can you feel something in between your hands? Like a magnetic pull or a pull push? You feel like warm or cold current? You feel something like when you do this? Have you done this, man? Have you done this? So rub your palms like this, and once you do this, you can feel like a warm current or a magnetic field. This is nothing but the bioelectric currents or the energy what we emit. When this energy is high in us, we are more immune. We are more immune to any immune disorders. We can withstand any kind of virus infection or any kind of infection. Not only virus, there are so many infections happening with patients, right? And you're the first people to go with the face infection. When your immune system is strong, you can avoid infection. You can take care of yourself from the infection. This is a basic exercise to feel your energy. We'll go with the next. If you all can stand in your place, I would love you all people can stand in your place and just follow what I'm doing, right? Can you all see me? Can you see me? Somebody has to give me a response and we need something to go forward, right? Breathe in, take your hands from the side, bring them up like a namaskar posture, and slowly bring your hands down, chest level, and drop your hands to the side. When you drop your hands to the side, and slowly raise your hands up. Hold your hands like this for a few seconds, and just drop your hands. Please follow along with me. And turn your palms towards your hips. And slowly bring your hands in front of the palms facing upwards. Turn your palms like this. Just stand there for a few seconds, few cycles of breath. Then slowly what you have to do is to bring your hands one above the other, right hand above the left hand, and just 3 inches below, 2 inches below your wrist line. Both the hands. Right hand above the left hand, palms facing downwards. Just stay there for 10 seconds. Then slowly turn your palms upwards. Again, the same distance, the 2 inches below your wrist line, just stay there. And slowly bring your hands like this. Slowly bring your hands like this. And move your right hand up to the level of your nose and turn your palm. Bring your hand down slowly. The left hand should be close to the navel. And move your hand up and down, up and down, up and down. Now keep your hand at the chest level, press and circle. If you feel your hand, both the wrists are connected, it's great. If you don't feel, nothing to worry. Just feel. Once you feel they are connected, then drop your middle finger like this and slowly take it down to the bottom hand near the wrist. Then pull and push it down. Pull up and push it down. Keep your hands relaxed. Some of you may feel like a laser kind of magnetic force moving with your fingertips on the wrist. Just move it. Then bring your hands closer like this in front of your chest. See that? Make a small circle. You may feel, though you're not touching your hands, you may feel the hands, both the hands are in contact. Then separate your hands and turn the palms. Then slowly move your left hand above the right hand this time. Same 2 inches below your wrist line. And just then slowly turn over your palms. Move your hands up and down. And slowly turn your palms. Keep it just close to the navel. Move your left hand up this time to the nose level and turn your palm. Slowly press and take it up. And take it up. And take it up. Press and take it up. Press and take it up. Press. And once you feel the connection, drop your middle finger. Then slowly bring your finger down to this wrist. Push and pull up and down. Then rotate your finger. Do you feel something like a magnetic force or a wave or an air? Once you feel that, just stay there and slowly bring your hands in front. Make a circle. Make a circle. And stretch your hands out. And turn your right hand palm like this. Stay enough a few cycles of breath. Then turn your palms facing each other again. Just move your hands closer, take them away. Move your hands closer, take them away. Bring them closer, take them away. Bring them closer, take them away. Then slowly bring your hands closer and drop your hands down. You may feel your wrist heavier than before. This is what we call as basically single finger Zen. Zen is nothing but meditation, and single finger we call because we can concentrate the energy to that level where it can penetrate deep inside into your organs. So see, I do agree with a lot of times what people call today COVID-19. As nurses, you all know much better than us. You are seeing right now, you might be seeing a lot of patients. Whenever this kind of pandemic happens, whenever this kind of virus attacks, it just kills the lungs first. And then slowly it kills your heart. Then slowly it kills your spleen, liver, kidneys, whatever it is. But why you people have to be much healthier? The reason is the impact from the patient to you will be more 10 times to 100 times more than what you think. Because do we may be into more precautionary gadgets, whatever may be, but the virus from one patient, different patient, it will definitely have an impact on it. Maybe a physical impact, maybe a psychological impact, maybe a lot of stress, and even you can fall sick. And I also believe that the aftermath of COVID-19 will be much more dangerous. We might be not having such a disorder or disaster what we are seeing in US and all, luckily in our country. So disaster is there. So now we'll go with few exercises, what I call as bone marrow cleansing. You all understand bone marrow? Bone marrow cleansing is a very important thing. What once you start cleansing your bone marrow, even you know that bone marrow is transformed for the is given to the patients of cancer get healed. So bone marrow is if your bone marrow you can what you call cleanse or you can what you call as bone marrow if you make it much stronger that will become you will become much more healthier. They are very simple exercises. After these exercises, I'll be teaching you all how to align your posture because when you stand and sit from morning to evening for a long time, when you sit and stand, you have different postures, you have different weights of different places. Hello? Yes, ma'am? So when you have different patients, when you have different yes, sir. Tell me. Somebody want to interrupt? Hello? So when you lift different weights of different categories of different persons, then you have to lift weight, you have to climb up, you have to come down, you have to run, you don't have time to have your lunch or dinner, whatever it is. In those times, if you're not energetic, then you'll be definitely into trouble. So what I'm going to teach you today is one is a bone marrow cleansing exercise to make your bone marrow more stronger. The second one will be what I would love every nurse to learn is taking care of your posture because posture is affected when you work in different conditions. And that posture can cause neck pain, shoulder pain, back pain, or knee pain, or hip pain, or ankle pain. And what I'm going to teach you in the next session of these exercises, take it down from me. You'll never get a knee pain. You'll never get a neck pain. You'll never get a low back pain. Even if you get it, it will be taken care in a very short time. Because we all know medicine can cause more damage. Antibiotics can make your muscles fatigued and tired. But exercise is something, because we always say in Chinese, the food of a muscle is not a medicine. The food of a muscle is stretch and breath. Because as long as your breath is longer, you are healthier. As long as your breath goes longer, more oxygen goes to your body and muscles become much more flexible. Because when the muscle becomes tight, your organs will not function. Please try to take it very seriously because most of you people, when you work in different conditions for long hours, you get the muscular system becomes much more fatigued and tired. So let us start with the bone marrow exercise, which is a very important one. And in the last, I wanted to give something which is very typical. It's like a gift from my side because I still remember I have worked with more than 5 lakhs to 6 lakhs of clients in my life. In my life, last 35 years, I have trained a lot of actors, a lot of cricketers. I've trained a lot of doctors. I do get my clients from doctors when they feel that there's no need of a surgery and this knee don't need a replacement. I do some exercises for those patients to come back to normal. And in my own case, my ligament had a third grade tear. ACL was third grade tear. My meniscus was second grade tear, second degree tear, and medical science says that you have to go with the surgery, and it will take 9 months to recover. That's what till date I've not done a surgery now. It's 5 years now, 4 years now. I still walk. I do all my profession in martial arts, so I do all my exercises back, and I just took rest from physiotherapy and Tai Chi exercise. This is my honest statement because I know a lot of doctors know me because if I tell lies, they can catch me through those doctors. Even uh, rehab, when you talk about rehab, you might be saying physiotherapist and all. Tai Chi is a part of rehab in Australia and New Zealand. So shall we go with the first exercise? You are all ready for that? You all have to do is that you have to stand in the place where you are. Okay? So please stand in the place where you are and just start, move your hands from the side. Hope I'm visible. My upper part of the body is visible. Take your hands up again like a namaskar posture. Bring your hands to the side and just push your hands to the side. Just stay there. You have to do nothing. Just stay there. Just stay there. Put your mind onto your breath. Focus your mind onto your breath. Knees bend. Both the legs should be in one shoulder distance. Just stay for 1 minute. Then turn your palms. Feel as if lifting the whole sky in your hand. These exercises are very simple. You can do it any place, at any time. Just feel as if you're holding the whole sky in your hand. Now turn your palms facing downwards. Feel the pressing water under your palms. Then slowly bring your hands to the posture of laughing Buddha. This is a wonderful exercise to take care of blood sugar. It controls the sugar level in the body. These are something known as standing meditation. Keep your hands, first one is keeping your hands to the side and holding to a wall. The second one is as if you're holding the whole sky in your hands. The third one is arms facing down, as if you're pressing balloons on the surface of water. Then slowly bring your hands up, as if you're holding the sky. Once you finish 1 minute each of these exercises, bring your hands down. The reason is we call this a standing meditation. I'm a person who has given results in posterior gland cancer. That put me to IIT Madras, where I do have sessions with the IIT students to overcome the stress level. And how it helps. We always say, God, the best engineer who made us, and he has created a wonderful factory inside us. We produce our own medicine. And we stick on to that. If we take care of your health, if you take care of our health, definitely a great job will be done for people like you to support us to come back from any health disorders. The next exercise, what you would have preferred to go with is one of the most costliest exercise. In US, they charge 1,750 euros, and I feel it's something which is very, very important for all of you to learn. And I will share these copies of this to your team, to the nursing head team, and that you can receive from there. So this exercise is known as 6 healing sounds. 6 healing sounds are going to work on your internal organs. Your organs like heart, lungs, liver, spleen, kidneys can be detoxified with the help of a sound, because we say certain vibration can create an energy in certain places. So every organ has its own vibration, and we create a sound which helps that organ to work much better, because in case of most of the pandemic or most of the viral infection we have seen, the vital organs give up faster. Not only that, I wanted to share you on me, being we all on your nurses department. I wanted to share something which is happening in the country, which has been kept secret for a lot of people, but we all know it's an open secret. Infection of the hospital infection. A lot of cases die in hospital infection. I think we all agree with that, right? When you have a questionnaire, you can ask this question. We have seen that a lot of cases die, a lot of clients die, lack of cleanliness in the surgical system or whatever it is. What we call as infections, hospital infections. Though there are 21 kinds of different antibiotics, nothing works for them. And once this infection starts, every organ dies, people die within 5 days. They will die within 5 days. So please try to understand people, those who live in that place, you have to be more healthier than others, right? So this 5 or 6 healing sounds will start with the liver sound first. Liver is the organ which stores stress, and anything goes wrong with the liver can be seen through the eyes. So you all know where the liver is. Put your mind onto the liver, feel your liver. Breathe in through your nose. Feel the breath to the liver. When you breathe out, just breathe out with a sound. Shoo. And what you have to do is, when you breathe in, close your eyes. When you breathe out, open your eyes as wide as possible. Because, as I said, eyes are the windows of your liver. Anything goes wrong with the liver can be seen through the eyes, like jaundice, fatigue, sadness, anger, and even people, those who take excessive sedation, it can be seen through the eyes. So shall we do this? I'll make you do three times, but when you have time, please do this six times. When you breathe in, close your eyes. Focus your breath to the liver. Breathe out, open your eyes as wide as possible with the sound. After that, rub and massage your thumb with the thumb and index finger of the other hand. Then lungs. Lungs are your roof of all the organs. Keep your hands in line with the lungs. When you breathe in, you don't have to close your eyes in this. Breathe in, fill your breath into the lungs. Hold your breath there for a few seconds. When you breathe out, go with the sound, hissing sound. Breathe in, breathe out. Breathe in, breathe out. Once you finish 6 times, rub and massage your index finger. The third breath is for the heart. And heart, your movement, keep your hands in line with the navel. When you breathe in through your nose. Fill your heart with fresh air. When you breathe out, go the sound he. Breathe in. Fill your heart with fresh air. When you breathe out with the sound, feel all the toxins going out of your heart. Breathe in. Breathe out. Breathe in. Breathe out. Once you finish 6 times, rub and massage your middle finger. Then you have spleen and stomach. For spleen and stomach, keep your hands up like this. Look at the floor, 3 feet in front of you. Breathe in, fill your spleen and stomach with fresh air. When you breathe out, feel all the toxins are going out of your mouth. The sound whoo. Bring your hands down slowly. Rub and massage your ring finger. Now the little finger. We all know in school we will say, Madam, one bathroom, Miss, one bathroom. We'll show the little finger, right? We never know why, but it's been happening since generations. Your little finger is connected to the kidneys and bladder. There's a reason we don't know. From centuries been there. We always raise a little finger if we want to go for one toilet, right? So what you have to do is for the kidneys, you have to bend, hold the knee, look forward on the floor, look forward on the floor. The sound is when you put water on the dosa pan. Breathe in, put fresh air into the kidneys. When you breathe out, then rub and massage your little finger of both the hands. This will help in taking care of your low back pains or bone issues. If bone density is less, we will really take care of that. Osteoporosis, osteoarthritis, all these people, those who suffer with the deficiency of bone or maybe bone density, what you call, mostly women suffer with that. These exercises will definitely help them to cope up at the hormonal changes at the later stage of your life. Just try to understand the world is changing today. You might have been helping all the people today, but as you grow old, you need a lot of support. And today's world is very difficult. I still remember I was sharing a story of Aruna, the nurse, who had a pathetic death. And that the love and compassion what other sisters showed to her more than 27 years or 29 years, they took care of her and she was in coma, right? So today we don't see people having that kind of passion, compassion to help you out. You have to take care of your health because nobody has time. We may have time to call our parents today, but our kids will never have time to even call us. So please do this exercise. The last and the sixth breathe out is a very effective exercise. Throws the kidney stones out. The bladder and kidney stones will come out with a small size. They are in a small size and it's going to help a lot. It's very simple. And what you have to do is clench your teeth tightly, touch your tongue to the upper palate. Same like liver sound. You will go with the sound shoo. Breathe in, clench your teeth tightly, touch your tongue to the upper palate. Go with the sound. Six times. This will take care of so many health disorders. And the best time to do the last exercise, that is six healing sound, that is like clenching teeth, is when you wake up in the morning, early morning, first time when you want to empty your bladder. If you do this, it will stop the bleeding gums. It will take your, what you call renal stones will not form. The third thing is that it will keep your immune system high. You all know that urine is taken as a therapy in a lot of disease. I don't know how many of you know me, you might have heard about it. People take their own urine to cure so many health hazards. So this exercise should be done early in the morning when you wake up. First time when you want to empty your bladder, when you want to empty your bladder, please clench your teeth, touch your tongue with the upper palate, and go with the sound and empty your bladder. It will cure urinary tract infection. People will not get urinary tract infection. Apart from that, small, small stones can be thrown out. These are impact of this exercise. If there would have been no impact, definitely no doctor would have believed me all these years, as I've given wonderful results in people in different walks of life, right? So next posture, as I promised, I want every nurse to stand and do this exercise, because this will keep your posture in alignment. Because the whole day when you work hard, whole day when you work hard, it's a very simple exercise. You don't need a big space. You don't need a big space. You can just stand in the place where you are sitting. And it's very simple exercise. I'm going to go into long distance and show you how you have to do it. You have to lock your hands. You have to lock your hands in the back of your head and bring your elbows together. Okay? Your feet should be together. Your feet should be together. Your legs should be, keep your legs together. Keep both the legs tight from the hips to the toes. Everything should be tight. And when you breathe in, raise the heels up. Touch your shoulder blades. Breathe out. Breathe in. 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 Breathe out. If you do this 30 times a day, any chronic severe neck pain will be taken care. I'm assured of that. And you don't have to worry about cervical spondylosis. A lot of people say cervical spondylosis. I'll tell you what's happening. See, you all understand the mechanism, human body's mechanism. Head is the heaviest part, right? Head is the heaviest part. Your head is the heaviest part, and your head goes forward. It's supposed to sit on the 7th C7, because our lifestyle, it goes and sits on C1, C2. Or when you bend too much with the patient, when you go for the work, your head, which is heaviest part, goes and sits on C1, C2, or C3, C4, causing a nerve impingement. And that can cause high BP, low BP. You see how disease comes. Pinching of the nerves which carry blood to the brain, and brain needs 80% of your oxygen. When the nerves are pinched, flow of blood to the brain is reduced, and percentage of oxygen to the brain is reduced. That is a major cause of so many health hazards, right? Then, as I said, one exercise to take care of back pain, because it's very important when you work from morning to evening. Back takes a long breathing, and it's a very simple exercise. I've given this exercise to the pregnant women. I've worked with some of the pregnant ladies where the blood sugar has come down to normal. What you call a gestational diabetes has come down to normal. They feel very happy, because if you're gestational diabetes, you end up in Apollo paying more, not less than 3 lakhs, right? So how to take care of your back, which is very, very important. Mostly women go through back pain. Those who have gone for cesarean, those who have been with hard work, back gives up faster. How to take care of back? A small chair like this, or you can do it to the wall also. This exercise is very simple. Hold this dining table chair, or you have, or you can put your hands to the wall like this. You can put your hands to the wall like this. Putting your hands to the wall. And this exercise can be done by any pregnant woman who is in the 3rd trimester and having severe back pain. Only condition applies that the pregnant lady has to stay there for 15 seconds. Others have to stay there for 1 minute, right? So hold the chair like this. Hold the chair. Walk 4 steps back. Keep your feet at 1 shoulder distance. Make everything tight from the hip to the toes. Make everything tight. Tight, and it should be tight. And slowly push your hip backwards. Forward. Come down, and the upper button keel upper keel pohoto. Then you will get an S curve. When you leave this curve free, low back has to form out, which is very, very important. Okay? 1 minute to 3 minutes. Every day. வீட்டுக்கு போகும்போது ஆஃபீஸ் முடிச்சுட்டு தான் போகணும். And spinal cord, you all know, complete central nervous system is running in your spinal cord, and you have two brains. According to the science of acupuncture, there are two brains. Brain of communication is here, the head, and the brain of energy is on the below the navel. Brain of communication and brain of energy. Brain of communication here, brain of energy here. In the rendu brain naduvula spinal cord irukku. So when you work out these exercises, they will relax your back. It will create a normal natural S curve, which is very, very important for you all people, because you can avoid back pain. Take it down from me, you'll never get a back pain if you do this. And one exercise for your cardio, because we are seeing the heart problems are high. I've done a lot of sessions for the Vision India program for the PMO's office. What we go for the geriatric crowd, where we teach them to stay healthier with simple exercises. And I did this for almost 3 to 4 years. Obviously, now we have stopped it because now everything goes to Aisha Dawn. So I used to do it at NGO's team. And still people call me, still people, those who are still alive, old people, they still call me for their help. And this exercise, if you take care of your back today, it will take care of you in the long run. The next exercise is, you all understand, the world is going through a lot of cardiac issues. And what is happening is, sedentary lifestyle or no proper exercise or no proper standing can cause flow of blood to the heart will be reduced, right? And in yoga, we call Utkatasana, but what we do in Utkatasana is not effective. I'm going to teach you some exercise. It's a very simple exercise that will pump more blood to your heart. It will pump the amount of blood which is required to the heart in a fraction of seconds, because the blood from the toes, from the legs, have to reach the heart properly. Okay? So, I hope you all can see me, right? Feet only or shoulder distance. Everything should be tight. இடுப்புலேருந்து கீழே பாதத்தை வரைக்கும் ஃபுல்லாக டைட்டாக இழுத்து பிடிக்கணும். அண்ட் டைட் ஹோல் ஹேண்ட்ஸ் இப்படி வச்சுக்கிட்டு, பாடியோட வெயிட் 80% ஹீலில் இருக்கணும், 20% ஸ்லோவில் இருக்கணும். ஜஸ்ட் கோ டவுன். Those who are following me, just stay there. Make both the legs tight. ரெண்டு கால் நல்லா டைட்டாக பிடிச்சிக்கோங்க, இழுத்து பிடிக்கணும். Make muscles tight there. Stay there. Stay there. Don't come up until I ask you to come up. Just stay there. Keep both the legs tight. Hold there. Hold your breath. Just stay there for some time. Keep your legs tight. Then slowly push your legs, press your legs to the floor and come up. So what I've given is known as resistance movement for the flow of blood from the toes to the heart. Otherwise, most of the people will be ending up with pacemakers in future. This is actual truth. So I hope you enjoyed these small, simple exercises. And if any queries or any other discussion you want to have, I'm open for that. And because my sessions, though they are tough on live sessions, I would love to come down and teach you. The last thing, the last thing, the last, arresting dandruff. Okay, comb your hair nicely with the tip of your fingers, then rub the back of your hairline crease. So control your BP. Then tap your shoulders nicely. Tap, 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 tap. Tap your hand. Tap the other shoulder. Nalla tap again. Tap, 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 tap. Tap your armpit. Tap your armpit. When you do this, this will clear your lymphocytes. Tap your lower abdomen. Make your hollow hit on the mid back, lower back. Rub your kidney. Hit hard on the center of your butt. That will take care of back pain. And just put one leg forward and tap from top of your thighs to the toes 2 times. Tap, 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 tap. So this tapping will relax every cell of the body. What we call as, you might have heard about stem cell therapy, right? So whatever it is, it will relax every cell of the body and all the tiredness and fatigue will go. Yes, can I? Yeah, I think I have done from my side. Any queries or anything you want to ask me? Am I reachable? Am I audible? Am I audible? Hello? Yes, madam. You can ask questions. Oh, thank you. You can ask queries. Anybody wants to have a queries, they can ask. Yes, yes, yes.
Hello, my dear nurses. Hi to everybody. Hello. Listen to me. Dear nurses, you can ask your doubts. Dear nurses, you can unmute yourself and ask your doubts, please. Hello, you can give a feedback. Hello.
You can send your feedback to your WhatsApp group or maybe by mail. And
sir, I think I will send you the feedback which I received through WhatsApp. Thank you so much for doing a wonderful session, and it is recorded. Circulating to our nurses to all, so that I will get much more feedback after that too.
Okay, ma'am. Okay, thanks a lot.
Thank you very much, sir. Thanks a lot.
Okay, ma'am. Yeah.
Thank you.